Hello everyone, I am Dr. Pavan Prasad, consultant surgical oncologist and laparoscopic surgeon from Manipal Hospitals, Jayanagar. Today I will be sharing with you a few aspects of self-breast examination. For ladies who are still having their menses, ideally it is advisable to do a self-breast examination a week after the periods. And for ladies who have already attained menopause, any time during the month is fine. Ideally, every month the same date has to be kept for examination. So how do you go about it? It has to be performed standing in front of the mirror, once with the arms by the side of the body and once with hands raised above. What do you look for during inspection, or rather when you look at the breast in the mirror? You have to observe, is there any asymmetry between the right and left breasts, any redness in either of the breasts, any abnormal bump or lump which is seen on either around the nipple area or anywhere along the breast, and also is there any nipple indrawing, that is nipple retraction. Once you raise your arms, observe carefully for the same points, whether the under surface of the breasts have any skin changes like redness or skin dimpling, or if you see any fullness or lump on the under surface of the skins, or once you raise your arms, is there any indrawing of the nipple, or otherwise called as nipple retraction. So these are the important things which have to be visually seen. And how do you feel for your breasts? It has to be through the under surface of the three fingers. Ideally, it can be done in sitting position or in sleeping position. First and foremost, you have to be calm and relaxed, and using only the three fingers, the under pad, gently go from center to the extremities or come from outwards to inwards. Never hold the breast tissue between the thumb and fingers like this. Never squeeze the tissue. So it has to be a uniform circular massage like movement, starting either from the central part wherein you gently go through the nipple areola region and progress all around the breast. So when you are doing it periodically, if you find any abnormalities like any changes in the architecture of the breast, or if you notice any lumps, or if you notice any nipple retraction like watery discharge, or if you notice any blood coming out of the nipple during the examination, this has to be brought into notice of your healthcare provider immediately. Similarly, you have to repeat the same procedure on both the breasts. So to examine the right breast, use your left hand, and to feel your left breast, use your right hand. Every month it has to be performed during the same day. In other words, suppose this month you have performed your self-breast examination on the 10th, ideal is to repeat the same in the 10th of next month. Any changes, even minute changes which you feel is not normal compared to what it was during the previous month, please do not ignore these symptoms. Immediately please bring it to the notice of your healthcare provider. Remember, breast cancer is curable when detected early. Thank you.
Hello, I am Dr. Nitin Yashas, a medical oncologist at Manipal Hospital, Jayanagar. October, we celebrate Breast Cancer Awareness Month. Every year in India, close to 192,000 new cases of breast cancer is diagnosed. Most of the times, they are diagnosed when it has already spread to the lymph nodes, which makes it an advanced stage. Sometimes they also present when it has spread to other parts of the body. Can breast cancer be detected early? Absolutely yes, with the help of screening test known as mammogram. Mammogram is an X-ray of the breast. Women in their age group of 40 years should start doing a mammogram at least yearly once. Anyone with a strong family history of breast and ovarian cancer, or have genetic mutations which predispose them to a higher risk of breast cancer, need to start this screening earlier, not only just with a mammogram but also with a MRI of the breast. Apart from this, we also encourage women to practice self-breast examination at least monthly once, where we would ask them to feel their breasts and examine for any lumps, swelling under the axilla for lymph nodes, any nipple discharge, any skin abnormalities. Why are we talking so much about screening and early detection? Because breast cancer can be cured. If detected early, the chances of cure are very high, because these days we have some advanced medicines. Not just chemotherapy, but immunotherapy and targeted therapy. Depending on the type of breast cancer and the stage of breast cancer, we combine chemotherapy with either targeted therapy or immunotherapy and shrink the disease before the patient goes for surgery and radiation. In certain types of hormone-positive breast cancer, We use certain advanced tablets such as hormone tablets and cell cycle inhibitors to reduce the risk of breast cancer from coming back after surgery. With all these advances available, it is very imperative that women are aware of this important message of breast cancer awareness in the month of October. Do share this important message because early detection leads to very high chance of cure.